the Africa CDC coordinating work on our behalf. By saying that we will continue doing our best, support the outbreak, support the response. Nigeria plays its role, both containing the outbreak in Nigeria, because with 200 million people, continent, if we don't have a safe Nigeria. So a big part of keeping the continent safe is keeping Nigeria safe. We also recognize that we have a responsibility to the rest of the continent. Continue carrying out the responsibility, supporting each other, learning from each other, and being a responsible player on the continent as we move forward. Thank you very much for this opportunity to answer any questions with you, but really grateful for your leadership of the continent in response to this outbreak. So, thank you.
Thank you very much. That was Dr. Chikwe Ihekwazu, who is the Director General of the CDC. So much, Chikwe. You took us through the total picture of the situation in Nigeria. So, talk about the need for collaboration, continuous collaboration in Africa. We have come to our question and answer session. Let me just remind you again, 2310. Alternatively, you can use the raise hand icon on this. Joe Foster, who is joining us on. Joe Foster, good morning. Hello. Joe Foster, can you hear us? All right, while we are waiting for that, let me take I will take the first two of 8. She is a journalist from media. The first two questions that I forward. Africa is set to hit 1 million COVID-19. Are we the next Brazil or India? But Dr. John made the reference to this. And the second question, is the continent's healthcare system now better prepared to deal with the rapid question? I'll put.
So thank you, Elizabeth, for your participation as always. And your two questions are extremely pertinent. We clearly are edging towards the 1 million number, which will be a milestone. And I caution that this is not time for us to panic and fear, but time for us to do what is right. We know the tools that work in public health, the non-pharmaceutical measures that are at our disposition. I was very deliberate when I mentioned in this briefing that about 37 countries still have less than 5,000 cases. Another 7 countries have between 5,000 to 10,000 cases. So if you add all of that, you still have a very good number. There are about 40-something countries that, if we are aggressive and apply those public health measures in a bold manner, we have a very good chance of fighting back. You talked about the situation in Nigeria, the biggest countries in terms of population on the continent. We're about more than 200 million people. And the fight they are putting out there. So, and the pandemic, we also have to know that is in some countries, or most countries, is localized. In Nigeria, for example, Lagos is the epicenter of that fight. In Africa as a whole, as we approach 1 million, we should also remember that more than 50% of those cases are coming from South Africa. So, why is this important? It is important because, as I indicated earlier, let's make sure we stay with the facts and not fear. I've said this over and over, that the way we win this enemy is that we do what we are putting out there as Africa's CDC and also guidance from WHO, which are the 4 key things. 1, let's mask ourselves in public. Mask, as Dr. Tedros used to say, test. This is time for us to mask ourselves constantly and appropriately. Second thing we need to do is to expand our testing aggressively and reduce the turnaround time. I really insist and emphasize on this, that the relevance of testing is not just to let people know that they are positive or negative. It has to have a public health perspective to it, which is we reduce the turnaround time, track those who are tested positive, and make sure that they are isolated appropriately. The third thing we must do aggressively as we go towards 1 million number is to engage our communities. Engage our communities. Coming next week, Africa CDC will begin a series of community leaders engagement, that is religious leaders, civil society, opinion leaders, that will engage them in a very deliberate manner and make sure that they own this process. We build the trust with the community as much as so that they translate these messages into the various communities. That will be a top priority, what we are calling the whole of society approach as we reach the 1 million mark. And lastly, call for all countries in Africa to deploy large number of community workers, what I call foot soldiers. That will be very, very important in ensuring that the community engagement works, that will ensure that the testing and contact tracing is effective. If we do those 5 things I just indicated, then we stand a very good chance of pushing back this pandemic and winning, which we don't have a choice. We have to win this war against COVID-19 as a continent to survive, especially as we ease the lockdown. The second question on this, are the healthcare systems ready? I have always indicated that you do not build your health system when you need them. You build health systems before you need them. In other words, I don't think we have the resources as a continent to build a 1,000-bed hospital in 2 weeks like China did. So we have to innovate ourselves out of that. The beauty is that many of those who are infected on the continent are symptomatic. I think last week, for those who were on this call, you heard a colleague from Uganda express and share with us that about 68% of their cases were asymptomatic. So that is good for our healthcare systems. It means we can manage those cases from home. We have to innovate ourselves by looking at what is it that we can do by consulting, using phones to consult so that you do not overwhelm our health system. I think innovation is key as we approach this critical number of 1 million cases. But to end there, I will clearly, again, I repeat what I said. We have to stay with the facts, use science, appropriate science to fight this pandemic as we hit the 1 million mark, be afraid of it. So facts, not fear.
All right, thank you. Chikwe, if I can come back to you for a minute to give us the situation in Nigeria. Are the systems, the health systems in Nigeria now better prepared to deal with the virus than previously?
Thank you very much, Rina. Thanks for that question. I'll answer it in 2 ways. We're definitely better prepared than we were 5 months ago, but we're not where we want to be. And this really refers to the point John just made. We've had several outbreaks in Nigeria, but they've always been in foci in particular parts of the country. And never have we responded across every state in Nigeria. So suddenly you don't only need to, we at the center don't only need to support an EUC in one state. We have